Good evening, Los Angeles, and thank you for joining us tonight at City Hall. We have the power to make decisions that will save lives. We can stay indoors, and we should, because we are safer at home. We can physically distance, and we should, because it saves lives. And we must remember that these aren't just numbers that we discuss. These are people, the people that we love and that comprise this amazing city of angels. And so I thank you again for all that you are doing to get us through this together and to save lives all around us. Every night I start by sharing data that you need. Let me jump in right away today. Here's tonight's snapshot. Today we learned in Los Angeles County that there were 548 new cases of COVID-19 confirmed, bringing the total to over 3,000, 3,011 to be exact, a 22% increase from yesterday. In the city of Los Angeles, there were 215 new cases, bringing our total to 1,386, an 18% increase. And additionally, and always the most difficult, there were 10 additional deaths. 10 deaths of people who we love and care for, who were connected to us and our families and our communities. And as always, our heart breaks for everyone who is mourning tonight. Those deaths represent a 23% increase over yesterday. Put differently, the number of deaths are doubling in our county every 4 days. As we heard from the White House today, COVID-19 could, in one projection, kill between 100,000 and 240,000 Americans. And that's if current physical distancing measures continue and hopefully are adopted throughout our country uniformly. Let me put that in perspective. That 100,000 figure at the lower end is nearly twice the number of Americans who died in the Vietnam War. Across the county in our general emergency hospitals, right now there are 1,382 available beds, including 222 ICU, intensive care unit beds, and an inventory of 861 available ventilators. And these numbers with the beds represent a 23% reduction over just the past 2 days. That's woefully insufficient. And we are working with suppliers to procure additional ventilators, but the need is urgent, and we need to have more partnerships, locally and globally, to build more medically sound ventilators. And I want to thank our friends in Northern California that are fixing the ventilators that were sent to us. I spoke last night with the mayor of San Jose, Sam Liccardo, and we appreciate the good work that he, our governor, are doing to make sure those are ready and available here in LA County. I want you to know that your decision to stay home may mean that there's one less person who needs a ventilator we do not have. And bringing case and death numbers down won't just happen because of physical distancing and isolation, but also because of testing, which every night I update you on, and we continue to grow our testing capacity. As of this afternoon, the City of Los Angeles testing program, which opened up a new site, completed 10,027 tests, including 1,623 tests alone today. And by Thursday, we'll have doubled our testing capacity, and we will administer 13,000 tests just this week alone. And tonight, I can announce that starting tomorrow, we are opening up testing to the entire county and expanding testing at 2 new sites. Thank you to Los Angeles County, who stepped up with 3 new sites, and also our first walk-up site as well. In cooperation with county partners, they're providing staffing, test kits, and resources to run the new sites. And to make signing up for a test seamless, we've integrated into the same portal. So tonight, as I promised folks who don't live in the city of Los Angeles, that we would make sure that testing is also available to anybody in LA County, because a life is a life is a life. You can go and sign up for one of those tests in one centralized location. We have, for tomorrow, 3,200 test slots that are available, and there's still room for more to sign up. So I encourage you to go to coronavirus.lacity.org and sign up to see if you're eligible to get tested. And if slots are filled for one particular day, as I mentioned last night, it'll now kick you over to the next day so we can get you in as soon as possible as we continue to grow our capacity. And I want to thank our nonprofit partners. I want to thank our corporate partners. I want to thank our government partners who who are making sure that Los Angeles can get the tests that we need. We're continuing to see a strong response to our emergency shelter program, and I want to thank members of the Los Angeles City Council, neighborhood councils, and others, including our service providers, and of course our remarkable city employees who are stepping up together with county employees and others to make sure that all of those shelters are filled. In addition to those which are more than 95% filled, and 13 more we are building to open just this week alone, we have 900 motel and hotel rooms that the state, Homeless Services Authority, and county partners with the city have secured for isolation and quarantine. Some of those are already being used. And I'm grateful that FEMA and Administrator Gaynor approved the state's request for 75% reimbursement for all the hotels and motels that are being activated to meet the needs of this crisis. This is historic. This has never been done in a disaster before. And I'm grateful to you at FEMA, to Washington, D.C., and that allows us to feel good about that money that we're spending as quickly as we can get those rooms to help people as quickly as the need is there without having to worry about us being bankrupt. There's one final stat I'd like to share with you tonight. It's a number I haven't shared before. But every day, thousands of Angelenos call us. Yesterday alone, we answered 2,509 calls from folks seeking information on how to stay safe and healthy during this crisis. Others checking in on which city operations have not shut down. And these calls are picked up by an incredible team of 311 operators and members of my own office who have stepped up to volunteer, and volunteers who have come in to supplement those teams as well. And I want to thank those dedicated public servants for answering those tough questions, allowing us to continue to focus on the tough decisions ahead and making sure that we get this city continuing to work. With that, let me turn next to some announcements that I'd like to share with you on the steps we're taking to address the city's immediate needs and to plan for weeks ahead. As most of our city has stayed home or changed the way of doing business, much of our construction program has continued. Critical infrastructure projects like homeless shelters and housing should move forward, but never at the expense of our workers' health, never at the risk of anyone's life. Since I signed the Safer at Home directive, we've heard about some construction sites that are not following those guidelines. That's why our city's Department of Building and Safety has developed new guidelines for construction sites to ensure employers and workers are safe and protecting public health and their own health. The guidelines are posted at LADBS, that's Department of Building and Safety, ladbs.org, and they'll be up there tonight. But it requires all construction sites to develop a comprehensive COVID-19 exposure control plan, including protocols for symptom checking, physical distancing, and hygiene practices, and decontamination procedures. Additionally, we will send our city inspectors to visit construction sites every day to verify compliance with these safety guidelines. As we required in our Safer at Home order, workers must maintain a 6 feet physical distance, and they are discouraged from sharing phones, desks, offices, and tools. And every worker who is at an active site has to be trained on preventing the spread of COVID-19, including distancing, hand washing, facilities on site, and the most effective methods for disinfecting surfaces that are touched often. And any worker who is sick, like everyone else in Los Angeles, must stay home. We will not be shy about shutting down construction sites that do not comply. So comply. Continue the critical work that you are doing, but in the meantime, make sure you are keeping your people and all of us safe. As I mentioned in my first press conference on this, all of us are first responders when it comes to this virus, not just our brave police officers and firefighters and our healthcare workers. And that includes developers, construction companies, and workers. And while construction is very important to continue in this critical moment, any site that puts lives at risk will be shut down. It's as simple as that. And as we've stated repeatedly, if any non-essential businesses continue to operate in violation of the stay-at-home order, we're going to act to enforce the Safer at Home order and ensure their compliance. 1 week ago, I announced our Business Ambassadors program. This is a collection of city employees and members of my crisis response team who've stepped up to ask non-essential businesses to shut down, and where they won't, to refer them to law enforcement. As of this afternoon, our ambassadors had deployed to 540 businesses. Almost all responded as we hoped that they would, by simply complying with emergency order and immediately shutting their doors. LAPD has visited 144 of those locations to confirm that they were abiding by those rules, and we will keep following up, and we will bring forward misdemeanor filings to the city attorney if necessary. So far, 4 have been referred. That low figure is a sign that folks are complying, that our best enforcers are not government, but one another. And we need to make sure that everybody continues to let us know where those folks are. If you've observed recurring violations of the Safer at Home order, please continue to let us know at coronavirus.lacity.org/business violation. You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are all safe. Look, I know that this is tough. I know that life feels fundamentally changed. And trust me, I have no joy in, and the rest of our city government and county government has no joy in stopping our way of life temporarily. But we are doing that so that the deeper we abide by these rules, the quicker this can be over. And we want to make sure that nobody harms our small businesses, the backbone of our economy, or workers who keep them going. But these are not ordinary times. Everyone has to keep making these temporary sacrifices for the common good, for each one of us, because the person we make the sacrifice for could be ourselves. Our lives depend on us each doing our part, so thank you, and I ask everybody to continue complying. Helping Angelenos in greatest need is at the heart of so much of what we do. It's at the center of our campaign to bring the generosity of philanthropists and other leaders together through the Mayor's Fund for Los Angeles. And tonight I'd like to report another $1 million contribution from an anonymous donor. You know who you are, and I personally want to thank you on behalf of 4 million grateful souls here in Los Angeles. But they are helping us in a very direct way by allowing those Angelenos in greatest need to purchase groceries. And there's more assistance on the way to ensure people can keep putting food on their tables. We found that the best way to dole out this aid is through pre-loaded gift cards. And when we set out to acquire them at scale, our friends at Ralph's, Food for Less, and the Kroger Foundation, who are all part of the same team, and separately, our friends at Albertsons, Vons, and Pavilions, responded enthusiastically. And they're not only getting the cards set up, they're adding on to this anonymous contribution so that we will have a total of $1.2 million in groceries for some of the neediest people in this crisis. On top of that, I want to thank 2 people who have filled our lives with joy and happy moments, Rihanna and Jay-Z, who both stepped up as well with such generosity to help us out. They've already been giving through their foundations in other places like New York, in the Caribbean, but this is also a place that they know and love and call home. And I want to thank you for stepping up, and I hope it inspires some other folks in the music industry and other stars and athletes to do the same. We thank everybody who's given. Now is the time that our people need you. All of these donations go a long way to ensuring that we have that we have child care for our health workers, that we have meals for our seniors, and that we can ensure that people get the cash assistance that they need, things like groceries and the basics to pay the bills. It's still early on, but there is still much more we can all do. And as I say every night, give to somebody who's local, whether it's a food bank or your church or synagogue or mosque. Give to the United Way. Give to anywhere you can. And one place we've consolidated some of that is at the mayorsfundla.org, and I thank you. There's another source of help that's heading here to Los Angeles. We've talked about it in the past couple days, but much needed relief from Washington, D.C., and it cannot come too soon. Remember, this has been a process. The first stimulus bill focused on preparedness and emergency response for FEMA. The second one was on free testing, on sick leave and unemployment insurance. And the third, the one on its way, is what I call the survival package, support for working Americans and small businesses. But I want to keep saying that the next step has to be on the recovery. We cannot let the punch to the stomach that is COVID-19 keep us on the ground economically after this is done. I was pleased to see both the President and Speaker Pelosi both talk about the need to make infrastructure the centerpiece of what's ahead. Because if we've witnessed anything in the past couple of weeks, it's not that we're lacking a human infrastructure of caring and compassion. We're lacking the physical infrastructure. In our health industry, we need it across our nation to rebuild and to get the stimulus into the economy that will help those who are out of work get back to work as quickly as possible. We need to reinforce our physical infrastructure from stronger waterways to power lines and broadband connections, just like the investments you have entrusted here with our public transportation, with our roads, at our airport and ports. We need to have a wider pool of medical equipment and a deeper well of medical personnel. We need investments in our ability to remain safer, healthier, stronger, and more secure for the next economic or health crisis, for the next phase of our economic development, and for the next era of American life. As we rise to this moment, let us set our sights on the horizon at that shared fixed point in front of us, that we will march towards and march to. And each one of us can say, looking back in these very darkest days, that we didn't picture how bad things would be in the future. We kept our eyes affixed on the hope and the help and the light that remains ahead. My friends, I know that this feels like we've been doing this for months, and for some it feels like normalcy was just yesterday. But we must keep with this. I'm so proud of Los Angeles. I'm so proud of the example that you are setting, of how you are sharing this love with one another, explaining this crisis to our children and grandchildren, and being the leaders that we need all of you to be right now. So keep up what you've been doing, and as I always say, stay safe, stay healthy, and stay home. Strength and love, Los Angeles. And with that, I'm happy to answer some questions. First question, please.
First question, please.
We'll go to Alex Michelson. Please go ahead.
Hey, Alex.
Hi, Mayor Garcetti. Thanks for taking my question.
Of course.
This isn't specifically a Los Angeles question, but it's the biggest story for our region right now. We just got news this afternoon about a nursing home in Yucaipa. 2 people dead, more than 50 people testing positive for coronavirus. It's raising a lot of concerns about nursing homes themselves. What kind of safety precautions do you advise for nursing homes, and are you looking at that as a specific issue going forward in the next few weeks?
Yes, thank you, Alex. We've been looking at nursing homes from the beginning. When we saw really the first beachhead in America was in Seattle, and we saw landing on the shores what happened in a nursing home that had the first kind of cluster of deaths. We immediately started talking together with the county at our senior home facilities. Our public health folks went out to those places, talked to people, and made sure that they knew that these are essentially medical facilities without many of the medical protections that a hospital has. Folks that didn't have personal protective equipment, and that is part of the cache that we have of those, is being shared with our senior homes. Second, that we don't have vents that protect from the spread like you would in a hospital, and so that people needed to be extra careful. And as we said early on, even before the stay-at-home order, cutting off visitor access, which I know is heartbreaking for so many families who have loved ones who sometimes may be confused about what's going on. Last week, I announced that we would start also to share our growing testing capacity with our seniors. And so I'm proud that starting yesterday, we began to work with senior professionals, senior doctors who work with our elder community, getting them testing so that we can make sure that testing is going. And where we've heard in the city of LA of potential outbreaks, we've surged in the ability to bring tests so that people can test everybody in those facilities. We've already done that in one where that happened. So we are continuing to focus on that. It is absolutely critical for every local government and all counties to be focused on that, because this is the place, as we're seeing, most of the deaths that are happening still, while the cases early on are, a reminder, over 50% under 50 years old. That said, the deaths are disproportionately, of course, our seniors. So to protect lives, to have our death rate come down, we need to make sure we are looking at seniors wherever they are, and that's a place that was brought home with that example in Yucaipa. Thanks, Alex. Next question, please.
We'll go to Mary Beth McDade. Please go ahead.
Hi, Mary Beth.
Hey, hi. Nice to speak with you again this
You too.
evening. Yeah, I just wanted to get your reaction on Cedars-Sinai. They are going to be testing out an experimental antiviral drug, and I
Yes.
guess the tests are going to be getting underway shortly here. Just your reaction that right here in Southern California that this is where the tests are going to be done, and then do you have any further input as to how they're going to be carried out?
So we have a lot of testing that's going on in California and Southern California. I would say maybe one of the biggest clusters in the world, if not the biggest cluster, not just here in the LA area, but in San Diego, up in the Bay Area as well. And it's very exciting that we have that capacity to not only help ourselves, but potentially help the entire world face this crisis. And we know there's a number of pharmaceutical interventions, treatment with drugs, and it's probably going to be a combination of drugs that are going to work best on the different aspects of both the symptoms and hopefully the prevention of a virus coming in and or expanding in someone's body. But secondly, too, to look obviously at the development of a vaccine. So I am familiar that Cedars-Sinai is doing that. They're not the only ones that are, but they're extraordinarily talented and have deep experience with this. I've spoken with other folks, people like Sean Parker and others, who are really helping lead a lot of this research. A lot of things that you will hear in the news take some time. So people saying the blood tests are ready, for instance, the pinprick, and you can get a drop of blood and find whether there's antibodies. I would slow down a little bit on how quick we think those are going to come to market at scale, and they have to go through the sort of clinical trials to make sure they don't have a lot of false positives or false negatives. In the end of the day, we will slow down this virus over the length of our battle with it, which will be, all experts have said, a year or a year and a half, by a combination of developing a vaccine and, of course, the medicine we can bring to bear that will help save lives. And much of that medicine will allow people to get COVID-19 but not die from it, especially those that are the most vulnerable. And those, to me, are the most exciting ones, like the antivirals that are being tested at Cedars-Sinai. And I know that there are a number of those studies going on up and down California with a lot of willing volunteers and, unfortunately, a lot of patients that are being tested right away. Thank you.
Thank you.
Next question.
We'll go to Dakota Smith. Please go ahead.
Hey, Dakota.
Good evening, Mayor. New York City Mayor Bill de Blasio has said that he's concerned hospitals in that city aren't getting the personal protective equipment that they need. To your knowledge, are there similar shortages of equipment, PPE equipment for hospitals within LA city limits? And what role is your office and the city of LA playing in making sure that LA city hospitals are acquiring the equipment that they need?
Thank you for that question. It's been heartbreaking to see those images come out of New York, where doctors and nurses and medical assistants are using page protectors and whatever they can find, Halloween masks, other things, because they've run out of what they need to stay safe. And we've seen it claim many medical professionals in New York who have become sick and some who have even died. Today, and we check in with the hospitals, we are making it through each day. My Emergency Operations Center has consolidated a lot of these purchasing, and we're trying to ask the hospitals what they need moving forward. Some feel like they have good supply lines, but I have Gene Soroka, the head of our Port of Los Angeles, as a chief logistics officer now for the city of Los Angeles, helping the region to buy all the PPE and or medical equipment and other things that we need. We're also talking with local manufacturers. I mentioned one last night, Wet Design, but there are many others too that are doing things like helping do the shields that doctors and nurses and others need, looking at what we can do to have non-medical grade masks from the apparel industry, looking at what we can do to make sure that the purchasing is done together so that we pool our resources instead of competing. But it still is a crazy world out there where people are spending 4 or 5 times more than the usual prices for things as basic as masks. So far, we've been able to help our hospitals get through where they're at, and they have been continuing to make their own purchases. The county has a cache that they have been really great with sharing, not just with healthcare professionals, but remember, healthcare professionals include our firefighter paramedics, include right now, they're not healthcare professionals, but people on the front line include our grocery workers, and we're seeing in New York, many of them get sick. We have also folks that are out there right in the line in critical businesses, and we want to make sure that whether they're government workers working in a shelter or others, that they have the PPE that they need. So my honest answer is today was okay. Tomorrow I feel good. But if you look a few days up, we have got to nationally get ourselves ahead of this, because we can't have certain parts of the country have a big cache and us having nothing. We have to make sure that we share this across all of our hospitals, so it's not just those that have and those that don't. And we're doing everything we can using the power of this city and our experience with supply chains and with shipping and with international trade, given that we're this big port city, and our local manufacturers to get even more. So stand by. We'll be able to make some of those announcements of the actual production, maybe even share some footage of that on assembly lines that have never made things like this, that are already getting tooled up as we speak to make even more. Thank you. Next question.
And we'll go to Ben Orestes.
Okay.
Please go ahead.
Hey, Ben.
Thank you, Mayor Garcetti. We just went up with a story about the first confirmed case on Skid Row, and I was hoping you might be able to update us on the latest numbers for homeless individuals and and shelter workers. And then also, do you feel like the city is prepared for an outbreak on Skid Row? I know it's something that advocates and public health officials are very, very worried about.
I'm very worried about it too. I think that we have one case that's been confirmed that I've talked about. There's another case that I've heard of, and I think you probably have in that story. I have been from the beginning of this, even when I heard about this happening in China. We've been working since January and February on this. Great news yesterday, as I mentioned in the speech. FEMA said that they will reimburse for hotel and motel rooms. We can't get those booked quickly enough. And yesterday I said to the county, whatever we can do to really focus a lot more of those rooms in downtown, especially near Skid Row. We need to be able to have the potential to quickly bring people from one part of Skid Row and get them into isolation, quarantine if necessary, and to make sure that the spread doesn't continue. Second, I mentioned last Friday that we were going to start testing in Skid Row, and not just Skid Row, but in a lot of the health clinics that do serve our homeless neighbors throughout Los Angeles. That has started. And that's a good sign, too, to have that capacity. Usually they would be the last in line, and when the last places to get things, I wanted to make sure that they were at the front of the line, too. A third point I'd make is while there's vulnerability out there, of course, we who were housed had COVID-19 before anybody on Skid Row, or anybody who was homeless was confirmed to have that. So it's come from us to there, but it has the potential, like wildfire, to spread. And so I talked yesterday to the judge. We're putting up more sanitary equipment. We've run out of any place to get more hand washing, but we're putting up more toilets, trying to procure them from across the country and the region to make sure that people can have more sanitary conditions, and to quickly be able to take folks and isolate them when any cases do come forward positively. But yes, short answer is I'm absolutely worried, and we can't have too much help. But it was great news yesterday knowing that that would be reimbursed, so that we can spend as quickly as the county can make these arrangements with hotels and motels, and we are very focused on those downtown. Thank you. Next question.
Thank you.
We'll go to Arlene Freer. Please go ahead.
Hey, how you doing?
Thanks very much, Mayor Garcetti. We have received and continue to receive daily calls from grocery store workers who say that they don't have gloves or masks to wear, and in some cases their employers will not allow them to wear them. What, if anything, can be done to help them or to ease their concerns?
So we have a ordinance that's moving forward, and that I'll be signing shortly, that will help us make sure that grocery workers have that protective equipment. We've worked with grocers and many of the main companies to make sure that they had access to our personal protective equipment, masks, gloves, very early on. I think it was my first briefing we talked about that. And we want to continue that flowing. But I will say to any employer, whether it's a small store or a bigger one, this is something you need to do for your employees. These are folks on the front line. We have seen what happens in New York, and we are not playing. This is something that is a requirement. Like all of our stay-at-home order, anybody who continues to work who's a critical worker, it doesn't mean that they don't have to have the protective equipment and abide by the spacing that is part of that order. That's up to grocery stores to make sure happens with the spacing. That's happened much better now than it did at the beginning, but we see all the time still people much closer than 6 feet. And that training needs to happen for employees, even if it means you stand down for an hour of the shopping hours, to train everybody and to ensure that they have that. I want to have a very clear message to all our grocery stores to ensure that's happening. If you don't have that equipment, we are happy to continue sharing what we have. And there isn't a lot of it, but I do see these clerks as heroes, these folks who are stocking the shelves as heroes. They are literally keeping us alive and fed during this crisis, and they deserve not to get sick. Thanks for bringing it up.
Thank you.
Next question.
We'll go to Steve Gregory. Please go ahead.
Hey, Steve.
Hey, Mayor. Good evening. Listen, you just said a few moments ago that you said snitches get rewarded. A little over a week ago, you actually said on this very press conference that you didn't want a city of snitches and tattletales because when I asked you the question about holding people accountable, is this sort of a sign now that you realize that there are a great many people out there not paying attention to the stay-at-home order? I mean, the freeways are more busy now than they were last week. More people are gathering than I've ever seen. And also, I have to rapid-fire questions because we get cut off on
Go ahead.
the phone.
No worries.
The other question was the portal that you have to sign up for medical help. We talked to a couple nurses today that said that they signed up the first day that they registered or that you announced it, and no one has contacted them. So are you getting back to all of these medical volunteers? And I'll let you answer. Thank you.
Thank you. On the second one, the state of California now has put out a medical portal too. I spoke last night to the governor's chief of staff with the 13 big city mayors in California, asking for guidance of whether they wanted to integrate those two together. And again, most of what we do, we're not a medical part of government. We don't have hospitals. We don't run things. We're trying to step up and help. So we have that available for hospitals. We have that available for the county to draw from in any of the facilities they have or fund, and for anybody else who needs them. We will draw from that where we see people that we need, for instance, somebody in a shelter, et cetera. But don't worry if you haven't been contacted. Not everybody's getting a call. We're keeping that and then going through and seeing, okay, we need an LVN here, we need an RN, we need a doctor over there, and trying to pull those out as we need them. And we appreciate that. We're also going to be sharing that database with the State of California database, which had, I think, 10,000 statewide just in the first night. So these are good consolidations, and just hold tight. I think early on I said a little tongue-in-cheek when I said snitches get rewards. We don't want to have folks that are snitching and putting people in jail, but we do want people to tell us where you see businesses that are open. And no, it is not a reflection that we see more slippage. We just want to tighten the screws up. We want to get, if we're at 98% compliance, I want to see 99% the next day. If we're at 99%, I want to get to 100% compliance, because these aren't just numbers. This isn't just a game. This isn't a competition. These are lives. And each one of those incidents could cost somebody their life. So we can't be perfect, but we're sure going to strive for perfection. And that network of people, look, you can snitch on each other. You can tell somebody, hey, you shouldn't be doing that. If somebody still is doing it, let us know. And we'll get compliance. As I said, with our program, we've gotten that 9 out of 10 times very willingly and very immediately. Where we need to visit somebody, we'll do that, and where we've had to refer folks to prosecution, like those 4 cases, we will do that swiftly as well. Thanks, Steve. Next question.
We'll go to Rosa Ordaz. Please go ahead.
Hi.
Yes, thank you, Mayor. The superintendent of public instruction is saying that the school year, we're not going to go back to school this year. How prepared is the city to help LAUSD, especially kids who don't have access to online material? They're getting an anemic education. How can you help remedy the situation? And also another question from my colleague is, we're seeing a glaring number out of Melrose, 100 cases. Is there any explanation why that number is so high? And is there any information we need to get to our viewers who've been in Melrose to help abate the problem?
Let me find out the second one. We've seen those same numbers from the county public health, and I'm not even sure where they draw that around. That may be kind of a mid-city neighborhood, and it's obviously one of the densest parts of Los Angeles, so there probably are naturally many numbers that are there. Let me get back to you on that. Maybe I can share that with you tomorrow. terms of LAUSD, I know LAUSD, which has a huge budget and even more employees than the city of Los Angeles, has been working really hard on those issues. Whether it's getting new laptops and Chromebooks, which they've been handing out at the grab-and-go locations. So if you're a family that doesn't have access, you now can get not only the equipment, but they have a historic partnership with Verizon to have low-cost or even no-cost internet access, so there isn't an anemic education going on. That will sometimes take a week or two to spread the word for folks to know, but at those grab-and-go centers, that's one place where that can be done. And at LAUSD.edu, you can find the details of those programs, as well as for other school districts in the Southland, I know, that are also struggling with this. Many of us are teaching our children at home, trying to figure out how to do virtual meetings, pulling things off the internet. But it's a good point you make, but from the very beginning, I've listened very closely in LAUSD with a lot of people, with a big budget, and with some great donations that have come in from pillars of our community, have ensured, as well as with corporate sponsors, that will get to as many children as they can reach, and hopefully all children, because you shouldn't stop learning just because you're staying at home. And we look forward to working with them. One of the things we talked about doing is making those links as easy as possible. And in future weeks, I think we'll start sharing not just staying at home, but living at home, learning at home, working from home, staying healthy at home. So look forward to those, and we're going to continue working with LAUSD to develop that, and other educators as well. Thanks for both questions. Next question, please.
We'll go to Claudia Pesehuda. Please go ahead.
Hi, Claudio.
Hi,
I'll get the
Eric.
name right one night.
We were expecting an update on the numbers of positive cases in LAPD and LAFD. I haven't seen that just yet, so I'm wondering if you have those numbers. And then wanted to ask if you foresee a situation where people might be forcibly removed from the streets of Los Angeles. And how would that play out? How bad would things have to get for something like that to happen?
So you're talking about folks that are unhoused, that are homeless? On that, I'm going to assume that you are talking about that in the second question. So no, I mean, initially we have right now many more people on the streets than we have beds, and whether that's in a shelter or the hotels and motels. If something does get bad in an area, I will take the advice of public health, and if public health says that it is best to move people, but the guidance has been from CDC is it is better to space and to take cases of positives away someplace where they can be isolated and quarantined. In the rare cases where somebody might clearly be spreading and refusing to move and interacting with people, whether they're housed or unhoused, that of course is a danger to anyone. So whether that's somebody who'd be running through a grocery store saying I'm COVID-19 positive, or whether it's on the street with somebody who's unhoused, I think we treat those equally. But the guidance has been for spacing on the street, for as many shelter and now isolation beds through the hotel and motel area, but we will have to see where those kind of pockets are and what the guidance is from public health. It's been changing a little bit from the CDC from the beginning to the middle section of this. They now give advice for how to run a shelter well, and also not to move people if there isn't a bed available for them. So I'm focused on the capacity of the beds, really continuing to push to get as many state, federal, and county resources. The county's doing a miraculous job of signing those leases as fast as possible. We're helping them. Council members and hotel owners and others are bringing us more rooms all the time. But that's something that we can only talk about when there are beds available, more than the people that are there. In the meantime, we will continue making that education, that testing on the street, and helping people space. The first question was the number of LAPD, LAFD. I don't have that offhand, but Claudia, we will follow up with you. My gut is it's less than 2 dozen between LAPD and LAFD. LAPD might be a little bit higher now, but I know it was low double digits for our fire department, and probably now, just given a bigger department, it might be a couple dozen LAPD officers, but I'll get you those numbers tonight. Next question, please.
And our last question in English comes from Elizabeth Chu. Please go ahead.
Hey, Liz. Go ahead, Liz.
Hi, Mayor. I was wondering if you have a number for how many tests have been administered among the homeless population, and also, if you don't have a number, how many tests you plan to administer next week.
Yep.
And also, I guess, I think that's all the questions I have.
Okay. We don't have the numbers yet because we just started yesterday. I'll try to get those for you, but initially we offered to our healthcare partners that already have clinics on Skid Row, clinics in the community, and others, the tests. I don't know how many of them they've actually done. We have the capacity to give them over 1,000 a day, potentially, through the UPS partnership that we have, and maybe in future weeks up to 2,000 a day, though those tests are being shared also with those doctors I mentioned who work with seniors. So I hope by the end of this week we will have had certainly hundreds done, if not into the 4 digits, but I'll get a report back from probably in that 2 or 3 days from each of those providers about how many that they have done and how many we get. And if we get any initial numbers from the first day, I'll see if we can get those to you tonight. Okay? Thank you. I think that was the last English question, correct? Is there one more? Okay. So I will switch to Spanish now. Thank you all so much. Buenas tardes, Los Ángeles. Hoy tenemos el poder de tomar las decisiones que salvarán vidas mañana. Sé que con quedarnos en casa y mantener la sana distancia, podemos reducir la propagación del coronavirus. Y gracias por su trabajo en este. Hoy en el condado de Los Ángeles hubieron 548 nuevos casos. Ahora tenemos 3,011 casos total en nuestro condado. En la ciudad de Los Ángeles hubieron 215 nuevos casos y tenemos ahora 1,386 total. Además, fallecieron 10 personas más. En total han fallecido 54 personas en el condado de Los Ángeles. Y lo siento mucho por las familias que han perdido un miembro de la familia. Nuestros hospitales ya están viendo el aumento de pacientes. Solamente tenemos 1,382 camas de hospital y 861 respiradores disponibles en el condado. Esto no es suficiente y estamos colaborando con proveedores para comprar más. El administrar más pruebas de detección también nos ayudará a aplanar la curva. Hasta hoy, la ciudad de Los Ángeles ha completado más de 10,000 pruebas y para el jueves habremos administrado 13,000 pruebas esta semana. Empezando mañana, estaremos abriendo el acceso para pruebas al condado entero en 2 sitios nuevos en colaboración con el condado. Tenemos 3,200 citas para mañana y todavía se pueden registrar. Visita la página coronavirus.lacity.org para ver si eres elegible para una prueba. Continuamos a ver una respuesta muy positiva a nuestro programa de alojo para personas sin hogar. FEMA y el administrador Gaynor aprobaron la solicitud del Estado para reembolsar el 75% para todos los hoteles y moteles que se están activando para esta crisis. Gracias, administrador. Y vemos que la gente quiere informarse. Cada día, personal de nuestro equipo 311 y de mi oficina contestan miles de llamadas de angelinos. Ayer contestamos 2,509 llamadas de personas preguntando cómo mantenerse seguros durante esta crisis. Estoy agradecido a los funcionarios públicos quienes toman estas llamadas. Y mientras trabajamos para ayudar a todos hoy, también estamos preparando para el futuro. Por eso, muchas de las obras en construcción han continuado a operar, porque proyectos críticos como refugios para personas sin hogar y vivienda deben seguir avanzando, pero nunca al costo de la salud de nuestros trabajadores. Sin embargo, hemos oído que varias obras no han cumplido con la orden de sana distancia. Por eso le he pedido al Departamento de Construcción y Seguridad que tengan inspectores verificando cumplimiento en varios sitios en la ciudad. Estos inspectores estarán buscando prácticas específicas que son esenciales para proteger la salud pública y asegurar cumplimiento con la ley, incluyendo lo siguiente: que todas empresas de construcción tengan un plan que incluye monitoreo de síntomas, sana distancia y prácticas de higiene y procesos para descontaminación. Y todas obras en construcción deben tener un supervisor para asegurar cumplimiento con estas prácticas. Trabajadores deben mantener 6 pies de distancia entre ellos y no deben compartir teléfonos, escritorios, oficinas ni herramientas. Cada trabajador debe recibir entrenamiento sobre cómo prevenir el contagio del COVID-19 y cada trabajador quien está enfermo tiene que quedarse en casa. Y si hay alguna obra de construcción que no cumple con estas reglas, la vamos a cerrar. Y seguimos el trabajo de monitorear el cumplimiento de todos los servicios no esenciales. Desde que lanzamos el programa Embajadores de Empresas la semana pasada, han visitado 540 empresas para informarles sobre la orden. Y la policía ha visitado 144 sitios para asegurar que están cumpliendo con las reglas. Si has visto una empresa que no está cumpliendo con la orden de cerrar, déjanos saber en la página web coronavirus.lacity.org/business violation o llama a 311. Seguimos recibiendo donaciones muy generosas. Hoy recibimos $1 millón de alguien anónima para apoyar a familias de bajos recursos con dinero para comprar comida. Estamos trabajando con los supermercados, Ralph's, Food for Less y Fundación Kroger, juntos con Albertsons, Vons y Pavilions, para usar estos fondos en tarjetas de regalo. En total, estaremos donando $1.2 millones con este esfuerzo. Y gracias a Rihanna y Jay-Z por sus donaciones al Mayor's Fund. Estas donaciones salvan vidas. Si pueden donar, por favor, visiten la página web mayorsfundla.org. Muchas gracias a todos por su valor, por su trabajo, por su visión y su amor. Quédense protegidos, quédense en buena salud, quédense en casa. Fortaleza y amor, Los Ángeles. Gracias. Preguntas. I'll take questions.
And our only Spanish question will go to the line of Leon Krause, with Univision. Please go ahead.
Alcalde
Leon.
Garcetti.
I'll start last second, Vic.
Vamos a escucharlo.
Ready at 6:14.
Ya estamos listos para la pregunta. Mr. Mayor, today we learned of worrying outbreaks of the virus in nursing homes. The elderly are particularly vulnerable to the disease. What is your government doing to protect the elderly? Hoy nos enteramos de brotes del virus en casas de cuidado de personas de la tercera edad que son particularmente vulnerables a la enfermedad. ¿Qué acciones está tomando su gobierno para cuidar de los adultos mayores, alcalde?
Sí, gracias. Las personas de tercera edad tienen un papel muy importante en esta lucha contra el coronavirus. Específicamente, necesitamos tener un programa en los hogares de las personas de tercera edad. Esta semana tenemos planes con doctores de personas de tercera edad y estos hogares a traer más pruebas de detección, miles esta semana con el programa con UPS y también con un laboratorio específicamente para esas personas. Nosotros hemos visto en Yucaipa, en Seattle, las tragedias con personas que están viviendo en estos hogares, y ellos son los más vulnerables de muriendo. Y es muy importante para mí tener estas pruebas, y también gracias al Departamento de Salud Pública, los trabajadores en el condado están visitando cada de estos hogares. En general, también es muy importante para nuestros ancianos, personas de tercera edad, quedarse en casa, porque las estadísticas de muertos, la mayoría de los muertos en Los Ángeles, en el condado, son personas que tienen más de 65 años. Ellos son vulnerables, ellos son los más críticos en esta lucha, y el rato de morir es un resultado de la ayuda para ellos. Gracias por la pregunta. Próxima, the next question. Oh, no más. It says, gracias, León, gracias a todos, y esperamos que mañana nosotros podamos traer más información, no solamente en la lucha contra coronavirus, pero las acciones que ustedes pueden tomar para finalmente parar la contagión de este. Muchísimas gracias. Thank you, Los Angeles, again, and we'll see you tomorrow night.